would all know that traditional microbiology is slow. It hasn't changed for the last 100 years or so. Sample is taken, it is incubated, bacteria will grow, we will do smear microscopy, then we'll do culture. Once the bacteria has grown after 24 to 48 hours, then we will do sensitivity and identification. As a consequence, the fastest we can get back to you is 72 hours. Your need is now. When you see a patient, you want help, you want some information. And we would pontify that, sir, give us the sample, we will tell you after 72 hours. So I keep telling the microbiologists that reporting, sending the report is only half of our work. If we want to help, then we should collate the information and give you that information. Today, we'll talk about sepsis. Sepsis is the leading cause of death in the world. And in India, of course, it takes much more than anywhere else. There was a study recently published in October 24, which says revealing alarming burden of tropical infection and antimicrobial resistance in India. If you look at the ICU, then if in the world 33% of persons who get admitted and have sepsis will die, in India it is 65%. One of the reasons was revealed by Kumar working in Toronto, where he published somewhere in 2006 that every hour delay of giving the appropriate antibiotic decreases the chance of survival by 7.5%. Every hour delay. Now, after many years of debate, recently the world has agreed that you have to have 1 hour bundle. 1 hour bundle means do 5 things the moment you suspect sepsis. One is measure lactate levels. And it is clear that lactate levels are associated with severity of infection. Second is collect blood culture. Third, administer broad spectrum antibiotic. Fourth, begin rapid administration of crystalloids for hypotension and so that if lactase level is more than 4%, and then apply vasopressor. So these 5 things need to be done in the first hour, and 2 of them are microbiology. As I said, microbiologists think that if you give sample, I will reply in 72 hours time. If you wait 1 hour, the chances of death are decreasing by 7.5%. So what we expect is that you will collect blood culture. And when in India somehow, we are very cost sensitive, but we should talk about cost effectiveness. Blood culture means 2 bottles, twice. That is optimum. But all self-respecting doctors would be very happy in India if they send 1 bottle, which is completely inadequate. By doing inadequate work, I am not sure whether we are saving money or we're doing disservice and making sure that the person stays longer in the hospital. What is required is 2 samples need to be collected within the hour and submitted. Then the empiric treatment, the second part was administer the first dose of antibiotic, which is broad spectrum, and this is where microbiologists can help. I've already told you microbiologists cannot help because their results will come in 72 hours time. How they can help is collate the information of the previous years, whatever samples they have got, whatever resistance they have got, they should then circulate that as an yearly hospital antibiogram to the serving doctor, to those who use the services. And this has been recommended by CLSI as M39, that every year you must collate the information and make that information available so that you are influencing the empiric treatment which you are required to do now, as well as the targeted treatment which you will do after 48 hours or 72 hours. Somehow Indian microbiologists feel that they need to do only the targeted treatment and not help in the first part. There are few exceptions, and we welcome and we acknowledge